Left untreated, can eventually lead to pulmonary damage and injuries. A cracked neck syndrome is defined as an incomplete fracture of a vital tooth, usually involving technique and sometimes extends towards pulmonary. Unlike a completely fractured tooth, a cracked tooth is not subject to disease. Most commonly, it affects the posterior teeth, especially mandibular molars and maxillary molars, because the teeth are exposed to electrical forces. There are several causes for cracked neck syndrome. One of the most common is biting and hard like bites. Teeth with large restoration are more susceptible because significant amount of teeth has already been lost. Other contributing factors include bruxism, teeth grinding, trauma, age, related bone structure, and heavy adhesive uses. The classic clinical feature is sharp pain by chewing, particularly when the bite pressure is increased. A patient often describes the pain as sudden and difficult to localize. Many also experience sensitivity due to cold winds or consuming sweet because symptoms are intermittent in diagnosis and sometimes be challenging. Diagnosis depends thoroughly on clinical examination. Dentists often refer to patient history, perform biting tests using instruments such as cotton wool, and may use fancy needles or magnification to identify the crack. Radiographs are also taken, although the crack itself is often not visible in the X-rays. Therefore, diagnosis is usually dependent on a combination of patient symptoms and diagnosis. Management depends on the extent of the crack. Management often depends on the crack. If the crack is limited and the pulp is healthy, the tooth can often be restored using bonding restoration or with a full coverage down to prevent further progression of the crack. If the pulp has become irreversibly inflamed or necrotic, the tooth can be removed, followed by crown placement is indicated. However, if the crack has progressed in split tooth or extend deep below the gum line, extraction may be the only possibility. Prognosis largely depends on diagnosis and prompt treatment. Tooth treated before the crack has extended to the root has much better chance of long-term survival than the one diagnosed later. Cracked neck syndrome is more common but frequently overlooked condition. Recognizing the characteristic symptom of pain on release of biting pressure, performing careful clinical examination and providing timely treatment is essential for preserving the affected tooth and preventing complications.